What up, what up, what? Okay, we are now live. Let me share this link with all of you on Facebook. Chatting with the docs. Just posted Facebook. Is anyone else having troubles with that book? Okay. And I think that's it.
Perfect.
We are up. Are you well situated?
Yes.
Hey, welcome to Chat with the Docs, your weekly supply of infotainment in the medical world. Notice we've got our, we've traded in our aluminum hats
Yes.
for lab coats.
Switch it up.
Do you like the clinical look?
Let us know. Drop a comment.
Yee-hoo! So this week, number one, if you want to be on the show, Carrie's waiting for your call at 608-314-8791, 608-314-8791. We've got your questions that were emailed into us, and if you've got a question and you're watching the show live, both of you, either of you, go ahead and give us a call. For a show that only gets between 2 and 4 live viewers, we do get some questions.
We do. Oh wow, there's a backside today. That's a first.
In my previously moxa-stained fingers. This week, I've been doing a little bit more moxibustion than usual. Do you know what that is? That's what makes this place stink funny. That's the stuff that makes this place stink like wavy gravy's been here.
But it helps, I know, because you told me the history with that and what they've used it for in the past.
Yeah. If you walk into a Chinese clinic, and I'm not talking about a clinic where a Chinese guy's working, but an actual Chinese medicine clinic. Oh, Morgan, you're so... No. Only creepy people and my sister call me Morgan. And there's a fine line between the two. That's okay. She'll never watch this. Anyway, if you walk into their clinics, they usually have this odd, herbally, sometimes even, you might say, cannabis-type smell. It's not cannabis. It's mugwort. Mugwort is in that same family, but there's no THC. There's no naughty stuff in it. What the mugwort plant is, it's ye in the Chinese, and it's used orally in a tea form, and it's also dried out and aged to perfection. We get the aye, the moxa that's been aged for about 20 years.
Oh, wow.
Very, very expensive. But we do that because it's much more powerful when working on the patient. So I use that a lot for managing symptoms of arthritis pain.
I suppose then it's more of a clean smoke than if it's got water in it, right? Then it'd be more smoky if it was more water left in it.
Yep, and the oils have a chance to condense down. The nutrients have a chance to condense down and crystallize.
Otherwise, it'd be like burning wet wood, where it'd be really.
Otherwise, it's really acrid and really foul smelling.
Okay.
And you can tell if your practitioner is using good stuff or cheap stuff by how yucky it smells. But I did that a couple patients this week, and you can smell it in the clinic.
I didn't notice it too bad when it came in. The one day I did. Today, not so much.
I had a patient once who was an active law enforcement officer, and he came in for treatment, and I had been doing that on another patient, and he saw the jar of it on the shelf, and he goes,
"You got a little bit, huh?
What is that?" And I said, "Nothing. You don't have any Twinkies on you, do you? I got the munchies, man." Didn't go over very well. But once I explained to him what it was, we were all right.
Little excitement in the Salome Center.
It's an exciting place. You should come. This week, I had a very heartbreaking and irritating situation. I had a patient who's been struggling with SIBO off and on for about a year. She's not asked me to treat it. I've offered. She's an older lady who's very content with her GP. All right, fine. All I can do is sit on the sidelines and say, that's a real shame they're going that way. Or I think you should get a second opinion.
That's very uncomfortable.
It's miserable. But she disappeared for a while, and she came back in the last week or so. And I just want to make sure that's getting sound from every direction. Well, she came in and she's been feeling miserable, and she's been taking medications now for SIBO for about a year. Well, they'll try this one and that one and this one and that one. And finally her doctor said, well, since all these medications have failed, I want you to just stay away from lactose. Don't eat any dairy products. If you or I were treating,
Mm-hmm.
wouldn't we make the dietary adjustment
First,
before we do anything invasive? Like, I don't know, chemicals,
yeah.
drugs, offering surgeries. She told me this, and it turned my stomach and made me just sick. And I said, you do realize that a year ago, when we talked about this first, I said, take out gluten,
Mm-hmm.
take out eggs, take out dairy, get a good probiotic. Well, I'm taking a probiotic. I've been taking a probiotic. My GP told me to take one. Great. But did you notice he's had you on all of these medications that have triggered a number of other side effects that you've been wrestling with? And now he's telling you to do the exact same thing I told you at the beginning, which could have mitigated all of this.
Mm-hmm.
And I'm not saying all Western medicine is like this, because there are some really good Western medicine docs. But so much of the time with these chronic situations, that's the approach. What drug can we throw at it?
Mm-hmm.
And after a year of using drugs and they're not doing anything, well, maybe we should change diet.
Backwards. It's totally backwards.
It's backwards. You should be starting least invasive and going gradually more invasive as we go. When I have a patient come into the clinic, they're coming in for acupuncture. I will start them with acupuncture. If I can get away with just NAET, that's even less invasive. Acupuncture, we're actually doing a procedure on you, a medical procedure where we're inserting medical instruments into your hide.
Mm-hmm.
That's an invasive procedure. But what's more invasive? Giving you supplements and herbs.
Drugs are a lot worse than things that actually help.
I don't even do supplements and herbs on the first treatment usually.
You got to see how
There's
the
a time
acupuncture
and place
responds.
for it, but I want to see how your body's going to respond to the acupuncture. You don't go giving supplements on your first visit to patients, do you?
No, usually I don't even do extra therapies. Usually I just stick to the exam that we know what's going on and then the adjustment. And I tell them straight up, I'm like, we can do these other options, but let's see how this does first.
You're establishing a baseline of care.
Yeah, because you mix too many things and you don't know if something doesn't work.
Mm-hmm.
What's
clouding the water?
Mm-hmm.
What's actually detracting from the therapies?
Mm-hmm.
But across the river there at the hospital, it's just the opposite reaction. They'll throw all kinds of, and that's why I'm going to get us kicked off the air here. That's why our COVID therapies aren't working very well.
Accidentally answered that. They're going to be mad.
That's why our COVID therapies aren't working very well, because we're doing just the opposite.
Mm-hmm.
How do you treat an illness? You decrease viral load, you manage cytokinins. Mo, you're oversimplifying things. Thank you for not calling me Morgan. You're not quite creepy. Yes, that's right. It is pretty simple. Now, depending on the severity of the virus and how established it is, it can be more complicated. But that's basically what you got to do. You've got to manage the viral load and manage the side effects of the virus. Usually, that's the cytokinin response in COVID.
Mm-hmm.
What are we doing? We're doing everything but. So,
Well, then they put out different things too, saying that natural approaches are making the cytokine storm. And it sounds like that's just what COVID is,
pretty much,
you know.
natural approaches, some of them can exacerbate it in the wrong hands. One of the things that irritates me is, you see these supplements out there that are over the counter, which is fine. I'm all for a free market, but the people that produce it would be much better served if they were going through practitioners only, because what's going to happen if somebody takes that antiparasitic drug or that antiparasitic supplement and they have a bad response to it? Maybe they have an allergic response to that.
And they don't even know it is
that
because they're
laxative.
like, this is how it should work,
And they keep getting sicker and sicker, and finally they stop and say, it didn't work for me. Well, it might be a very good supplement. It's just being used wrong. So you need somebody that knows how to use it.
Mm-hmm.
There are good alternative treatments for COVID. 90% of the cases in China we talked about a couple of weeks ago are being treated with acupuncture alone. In school, one of the things that we learned, I remember getting a whole lecture on cytokinins and how acupuncture reduces cytokinins. This was before COVID.
That's what it does. It lowers inflammation.
That's what it does. So maybe, and I'm repeating myself and looking back here because I'm waiting to get kicked off, maybe we should be getting a little more creative and looking outside of just what Mr. Fauci says. By the way, that reminds me, I do need to clean up after the dogs. You have joined us, both of you. Thank you.
We didn't lose anybody yet.
We haven't
huh?
lost anyone yet. No. Is our microphone? Yeah, our microphone is working. Everything seems to be up and running. So we are now 12 minutes into the show, and we haven't gotten to a single question yet.
We will. I just got to answer this. I hung up on a patient.
If for some reason we're running late like today for the show,
That's my fault.
there's a reason for it. It's because one of us was with a patient late. One of the things I'm very, very grateful for here is our practitioners put our patients first. Not necessarily the making sure you're in and out on time, because sometimes the patient's going to need more time, and we give that to you, which is why sometimes we're running late.
Mm-hmm.
It's not because we're out teeing off at the country club or having a steak somewhere.
We work all the way up until
We're
the show.
working all the way through. But we'll fall behind sometimes because sometimes you've got to take off your practitioner cap and put your listening cap on and let someone pour out what's breaking their heart.
Mm-hmm.
And you've got to sit with them and pray with them, and just, it takes time. And our patients understand that here because every one of them has experienced that at some point or another. So they know that if we're running behind, it's because we're trying to be a blessing to somebody.
Mm-hmm.
But just so that you know, the viewer knows that when we're running a little late, it's probably because we had to give someone extra time. Mm-hmm. And we consider this very important. We consider this an appointment with
you guys.
Usually about 6 patients a Tuesday. But we treat it like other appointments, and that sometimes we do run a little bit behind because we're giving it to other patients. Mm-hmm. That said, I'm going to go to Dallas. Dallas is lovely this time of year.
Alan in Dallas?
Yeah.
All right. I have been having problems with kidney stones on and off for the last couple of years, and it seems to be getting worse. The doctor says my tests all come back normal, but I'm getting sick of the repeated bouts of pain. Any ideas?
Alan, I wish we had you on the phone. There's other follow-up questions that I would love to ask, like what time of day do you get the pain? Mm-hmm. How often do you have it? Uh, where exactly are you getting the pain? I'm assuming because you've been to a doctor, they've checked it out and verified that it is kidney stones. I'm sure they've looked and seen the stones in the kidneys. But there's a number of reasons for it. Going straight Chinese medicine, we look at yin deficiency fire. So we're using herbs that are cooling, herbs that are draining. And we also use herbs that are going to nourish the kidney yin. So we want to protect the yin, we want to drain the heat, we want to put the fire out. Straight Chinese pattern. From more functional perspective, I look at it as, this person has a real problem with calcium. Why is their body not processing the calcium right? And normally, here's how it generally works with somebody that has an acute kidney stone issue, that the doctors are just waiting for it to pass and the person's miserable and they've just, you ever had a kidney stone?
Yes.
Oh my.
Mine was my own fault, though.
Do tell.
It was over Labor Day weekend. We went out to Pennsylvania. We were camping out and there was lots of drinking. So that was my fault. Dehydration. And it was hot.
My first kidney stone was, I was doing a lot of traveling for work and I was drinking a lot of that, what is it, airborne or vitamin C, emergency.
Oh, yeah.
And so it's that powdered vitamin C.
Mm-hmm.
And the powder that's with it doesn't sit well with my body because this is a hint, Alan, for what I'd look. I had an allergy to the minerals, the calciums, the electrolytes that were in there.
Oh.
And I was drinking a ton of it. I'm driving across country, using the vitamin C to stay awake, because why would you drink a Red Bull or something like that? That's just, I wouldn't even kill the gophers in my yard with that.
I'll say, how you respond to caffeine, that does not sound like a good option for you.
So, wait a minute, what are you saying?
So you can tell when it's not decaf. I could almost imagine you probably would get wings if you had a Red Bull.
This isn't decaf. I've graduated to the real thing. That actually takes us to another story, but we'll get to that later. When we get down to Barrie and Nashville.
So when you start talking really fast.
So Alan, what we would do is we would look at giving you Chinese herbs to do just what I described earlier, take care of that fire, that deficiency fire, and nourish the yin of the body, but also soften the stones and break those stones up. Kind of dissolve them a little bit, make them squishy so that they pass out with less pain. But we also treat you with NAET to clear your body's allergy to the calcium, which is why your body just doesn't know what to do with it, throws it out into the kidney, and these calcium ions start bonding together, and you end up with these clumps of calcium. If we treat your body's allergy to the calcium, usually within one or two treatments, the stone situation is gone, and your body quits having that problem. Usually, sometimes it takes more. Mm-hmm. But that's what we would do. We would look to treating the initial symptoms, treating the Chinese pattern, and clearing the allergy. Fix it so it doesn't happen now. Fix it so it doesn't happen again. So that's what we do. Alan, I don't know of any. I don't get out much. My family allows me to come here and to go to congregation on Shabbat.
That's
weird. When they do let me go to a place, it's usually Menards or Home Depot, and I'm on a short leash. I don't blame them, but I don't know practitioners down there, so I can't recommend anybody to you. I do have this. I might get in trouble for saying this, but I do have it on good authority that somebody is putting together a network of quality practitioners, starting in the Midwest and working out from there. So that will be changing in the future. So, Alan, if you have any other questions that you want to talk to one of us about, give us a call, 608-314-8791, and we'll be glad to answer any further questions you might have. Guess what time it is?
Time for the conundrum.
It's time for last week's conundrum. And we have an answer. Someone actually answered it. And to keep people from getting upset, I actually brought a new envelope so we can seal it.
Oh.
Uh-oh. Woo-oo. Dr. P. Diddy, right? Oh, that was Marguerite Kraken.
You made it.
I did. Lack of sleep, and I still made it. Oh, here it is. Do you want to read last week's conundrum?
Dr. P. Diddley Schmoozer, MD, PhD, DOM, DDS, and Eagle Scout
Ooh.
was listening to his patient,
I'll bet he was in 4-H too.
probably, complain about his tinnitus. The patient talked about the intensity and the volume. The patient said that he had his hearing assessed recently and had no hearing loss. Dr. P. D. Schmoozer,
He's an authoritative schmoozer.
yes, has asked the question, what does the tinnitus sound like? Does it sound like cicadas in the summer or waves at the seashore? The patient immediately said cicadas. What vessel did Dr. P.D. Schmoozer treat?
MD, PhD, DOM, DDS.
DDS is dentist, right? That's what I thought.
I am so sad for dentists that they no longer make Saabs. That was the perfect car for a dentist. Now what is it, Volvo? That's a dentist car.
Yeah.
Kind of somewhat sporty, but very safe. You don't really have to go that far. That's mean. I've got a good friend down in Beloit, Dr. Huff, who's a dentist. And he's one of the neatest guys I've ever met.
Mm-hmm.
You'll see him, and he'll be in his jeans, and he'll have these boots on, and you'll say, "What were you up to this morning?" "Oh, I was out hunting pheasants." Or
That's
you'll
fine.
say, "Hey, how was hunting this morning?" "Oh, I didn't go. I was working on the deck this morning." I mean, just a neat guy. He would not drive a Volvo. He drives an old Dodge Ram. It's pretty cool.
That is cool.
So the question of Dr. P. Diddy. No, he's not a rapper. It's not P. Diddy.
It threw me off when I
Diddley.
switched to PD.
P. Diddley. Diddley. He asks, was it cicadas? I always get
waves at the
depressed when the
seashore.
cicadas start singing.
Because summer's coming to an end.
Because that means summer's halfway over, and when I was a kid, that meant school was coming. Oh, I hated that. I hated school. And my teachers were not that happy to see me. So does it sound like cicadas, or does it sound like waves of the seashore? And he responded, cicadas. What vessel? So the answer was Zhui Yin vessel, or the liver vessel. Now, Alan wrote in a very interesting question, but he got it wrong. And he wrote in the anterior superficial temporal artery, which is a really good question because that's an artery that feeds. But the trick was we were discussing vascular bundles in Chinese medicine. Very good, Alan. What you suggested was a blood vessel along the Shaoyang vascular bundle. In Chinese medicine, typically it's referred to as meridians or channels. In fact, in school they used to call them channels or meridians. But that's not what the word luo means. The word that's translated typically as vessels or meridians, channels or meridians, actually means blood vessel.
Mm-hmm.
So when we're speaking in terms of the vessels in Chinese medicine, we're talking vascular bundles within a region of the body. Now, your answer, Alan, of anterior superficial temporal artery falls more along the Shaoyang vessel of the body, vascular bundle of the body, which would be associated more with the gallbladder or the Sanjiao triple burner. So great answer. You just off.
A little farther down the track.
Muy poquito, a little too shallow. So we must go more deeper. In case I ever need to find a new job, in case YouTube ever shuts me down. So the answer is Zhui Yin. Now, when there's Zhui Yin or liver constriction, you will often get that higher pitched cicada sounding, or even the sound of that high pitched buzz of like a fluorescent light.
Okay.
And you go, oh, I heard it. And it makes you more irritated. And you end up seeing this a lot in people with stress that don't respond well with stress, or they have a lot of high stress to begin with. So what's happening is that liver is real constricted, and you get that cicada sound. Now, conversely, I'm taking away the conundrum from 6 weeks from now. If it would have sounded like waves on a seashore, which of the viscera does that associate with?
Wouldn't be spleen or something, would it?
Good guess. Kidney.
Okay.
So kidney, when the kidney function is decreasing, sometimes you can get these tinnitus that sounds like more of a lower pitched waves on a seashore, or like wind howling. That speaks more of kidney deficiency. That, it's when you start going that deep into the body to affect the kidneys, you really have to utilize herbs. You really have to strengthen that kidney function. Usually, I'll use a formula that strengthens kidney jing, that will tonify both qi and nourish the yin of the body. Jing can do both. And so jing is something that it's one of the substances in Chinese medicine that's basic to everything. So provided there's not chronic infection involved, that's what I like to try to do. And I've only seen the kidney version of tinnitus just a couple of times. I see the liver all the time.
Is liver more of a common in our area?
Yeah. Liver pathologies are more of a first world problem. You have more.
Isn't that one of mine?
Stress.
Is liver?
Yes, and I've been meaning to talk to you about that.
Uh-oh.
Why must you be so high strung?
I don't have any ringing in the ears yet.
Ringing in the ears. Ringing in the ears.
I'll probably start tonight. I'm laying in bed also, and I'll start doing beep.
So that's the conundrum from last week. Wow, we wasted a lot of time on that. Let's go to Tanya. No, that was last week. Tanya, we answered you last week.
Maureen.
Tough tiddlywinks. Ooh, Maureen in Waterloo,
Iowa.
I hope the show isn't our Waterloo.
There's a Waterloo in Wisconsin, too. Other side of Watertown. I get severe migraine headaches probably once or twice a week. They are so bad I have to go home, close all of the shades in my room, and sleep it off. The pills my doctor gave me work sometimes.
We've got a lawyer that has to sleep it off regularly, too.
Oh, gosh. Works sometimes, but most of the time they don't do a whole lot. I do not notice any change from food, but I also notice when there is stress, they are worse. The pain starts in the back of my head and wraps around to my right eye. By the time it gets to my eye, I'm seeing sparkles and get real nauseous, and I am miserable. Do you have any ideas?
Well, first off, aside from the nausea and miserableness, people in college students who pay big money for that? Seeing sparkles, man. I'm going to let you answer this right first.
Well, I bet the neck is super tight with this. I bet that there's some trigger points in the upper trap, and that could also kind of come around by the eye. Could be some issues with the sinus because it's all tight in the back of the head and sinuses aren't draining and then getting some pressure. Mm-hmm. But mostly, well, you've even said this like a week or two ago. If you got a headache, It's usually in the
Look at the neck.
cervical.
Look at the neck. Now, Maureen, I wish you could be on the phone with us right now. I wish all of these people could be on the phone with us.
Mm-hmm. Get a little bit more info with questions that we have, and
if you can, because I know most of our viewers watch us after the show, but if you can be available when you write in your questions, feel free to leave your phone number and see if we can schedule for you to be on the show for some follow-up questions. Number one, Maureen, to have a headache that severe once or twice a week, you got to be tough as nails, lady.
mm-hmm.
That's brutal.
That's hard to get anything done.
You can't function. I'm assuming the pills that they gave you were probably Imitrex or something along those lines. Number one, to me, it doesn't sound like a migraine.
Sounds like tension headache to me.
Tension headache, maybe some cluster headache involvement,
mm-hmm.
but it doesn't sound like a migraine. And most of the time, when someone comes in saying, I get migraine headaches, it's not migraine headaches. Migraine headaches used to be very specific.
Mm-hmm.
This one, she says, starts back here and works its way around. So what does that tell us? The problem's back here.
Mm-hmm.
C1, C2, C3, C4, C5, C6, C7. Can't go beyond C7. There's only so many verses to this song.
Unless it's nerve roots and there's C8. We got the train too for that one. Even he's impressed.
Wowee. Yes. So we would be looking at your neck. Maureen, find somebody, an acupuncturist that can work on your neck, chiropractor, a good one that can work on you.
There is hope.
There's hope. You don't have to be like this. You don't have to be sick all the time. You don't have to be chained with these headaches.
He's stuck in bed.
Get some treatment. If you were to come to me, if you were coming to this clinic, number one, we would tag team you.
Mm-hmm.
Number two, we would set you down. We'd check for food allergies to see if anything like that is contributing to this pain back here. And we would also be treating you for releasing all of this tissue back here and trying to stabilize those facet joints, trying to stabilize all of these joints and tissues.
So it's not so mobile that it doesn't keep triggering.
And if you were having an acute attack of these headaches, I would say get yourself in here.
Mm-hmm.
Because usually, 9 times out of 10, within a few needles, I can get the headache to go away.
And that's awesome.
That's so much better than having an acupuncture or having an aspirin or an Imitrex.
What I even send some of my patients in that, we're working through the structure with trying to get things in line, but it doesn't take away the pain necessarily. But you can take away the pain pretty quickly. And I think that's awesome.
Yeah. Which, when you're working on the sequela from these injuries, maybe I'd like to know if you had a car accident at some point. I'd like to know if you've ever had some head injuries. I'd like to know some of your history, more of your history. But for the sequela from some of these injuries, I love that word. It makes me sound smart. I don't know how to spell it, but it sounds cool. Between the two of us, we can usually get that stabilized and get you worked past it. I've had a number of these patients who had these chronic headaches weekly, sometimes multiple a week, where you get them good chiropractic care, good Chinese medical care.
And they get somewhere.
And they become stable. And then it might be once or twice a year where they have a migraine. That's not fun, but that's more acceptable.
It's a lot better than twice a week.
Excuse me.
Got to replenish?
I'm going to replenish. So, yes, Maureen, there's things that we can do. You have options. There's even Chinese herbal formulas that would help you.
Mhm.
If you can't find somebody, give us a call. We can set up a phone consult and we can discuss what's going on, get to the bottom of things, and figure out what we can do to try to adjust this herbally. That's one of the beautiful things about Chinese medicine. I don't necessarily have to put needles in your hide. That sounds terrible, doesn't it? I don't necessarily have to perform acupuncture. We can do it herbally too. Herbally takes a little bit longer. You're not going to get that immediate release.
Sometimes you do, though.
Sometimes you do.
I mean, two of them
Sometimes
that
do.
you had me go on, I could notice pretty quick the difference.
Yeah.
And I love that GI Harmony. Like, I can't say enough good things about that.
Ready? Harmony. That is good.
And the Chandrasan? How do you say that?
Shaya-san?
Yes. For sleeping. That one was really good too.
Oh, that was Shazandra.
So that's what it was.
Shazandra Triple Z.
Yes.
Which is a really cool formula because it's not like melatonin, which goes puts you to sleep. Shazandra is some moving herbs, but it's full of tonifiers.
But I could tell it felt like I was taking an Advil PM, but it was natural.
But during the daylight hours, when
I
you're
was
taking
fine.
your daylight dose, it doesn't do that. Why? Because it's strengthening the yin of the body just a little bit, and it's strengthening the qi. So during the day, you feel fine. You're not feeling tired. You're feeling a little bit strengthened. But at night, it's strengthening the yin. So the qi starts to dissipate, and the yin starts to come out, and that yin hits you, and that the weight of that yin hits you, and you go, I'm feeling so calm and good.
Mm-hmm.
Totally different concept than just tranquilize and put them out.
Well, there's not too many herbs that I've taken in the past from other companies, just from doing your own research in that. I've never had that response like I did with that. And I was just like, holy cow.
It's pretty neat stuff.
It really is.
Chinese herbs are a phenomenal medicine in and of themselves. We spend 2 solid years in school. At least in our school, we were in an accelerated program we crammed 5 years into 3.
Mm-hmm.
So everybody with the attention span of a gnat does that. That's me. By the way, did you see? Never mind.
The train was going backwards today. Did you see that?
Did all 3 engines. It was cool. Woo woo. We spent 2/3 of that time of med school in herb class. Dr. Xie, one of the finest herbalists, as far as I'm concerned, in the world. And I don't say that because I need a good grade, because I'm out of his class. He passed me. And it wasn't because he didn't want to put up with me again. It was because he was a phenomenal herbal instructor. And the man, here's the quality of Dr. Xie, who practices in Chicago. When China had the SARS outbreak, that first one,
Moxibustion, wasn't it? That
he was one of the guys that was studying it.
Well, that's neat.
When I think it was Shanghai had an outbreak of some sort of weird foodborne virus.
Okay.
And it was plague type stuff. People were dying. He was one of the guys that came in, analyzed it, and got it figured out.
Wow. That's impressive.
He's cool. One of the sweetest guys too. That was Dr. Xie.
Can we read David from Eau Claire? Or did we just read his? No, we didn't.
Yeah, let's do David.
Okay. Gave me a look like we already read that, Noelle, and I was like,
no, I'm so tired, but I was trying to think of something smart to say. And I couldn't think of anything
Your
smart
eyes
to
were
say.
like, we just did that
So
one.
maybe my aunt is right.
I'll read it. Okay. So David from Eau Claire, Wisconsin. My doctor wants me to start on a cholesterol medication. He says I have high cholesterol and that if I don't bring it down within range, I will have heart disease. I asked him if there were other options because I heard bad things about cholesterol meds. He told me this was the best way to get my numbers down. The more I study it, the more I have questions. What do you guys think? I know you're going to be in pain if you start doing a statin. And I see that quite a bit when people go on it,
Does this irritate the snot out of you?
that they don't try the dietary first.
Does this irritate the snot out of you?
Yeah, it's so common.
You see, you handle it so much better than me. It might be because I'm caffeinated right now. Wowie! Yes. This is the best way to get your cholesterol numbers down, and the quickest way, and you've got to get this. I'm going to talk to you because I can see your eyes, and it's going to keep me grounded and keep me from good. Have you read some of the studies over the last few years that discuss about how there's no correlation between cholesterol levels and heart disease?
Yeah, considering. Yeah. And you need cholesterol.
Say that again?
You need cholesterol.
Yes.
It's a hormone.
What is CoQ10?
Cholesterol.
What is vitamin D?
It's a cholesterol.
What are your hormones?
Cholesterol. And there's good and bad. And you can control them with diet.
Cholesterol is not like politicians. Some of the cholesterols are good and needed, but you're read between the lines on that one, and you'll go, oh, that no. But Crestor and these other statins, they don't differentiate between the good cholesterol and the bad cholesterol, which is why
all of them.
Now you've got this whole industry of you've got to take this CoQ. I can't even say it. The CoQ10 is this particular brand is the best one. My doctor says to be taking with my.
It's canceling it out.
You need cholesterol. Yes, you don't want to have a cholesterol of 287.
But exercise, diet, you got to see what you're putting into your body.
What's your genetic propensity towards cholesterol?
Because sometimes people do have high cholesterol young, but you got to try the natural means.
And there are plenty of studies out there that suggest that higher cholesterol actually is conducive to longevity even. So you've got conflicting studies. So then you go back to, okay, who sponsored the study on cholesterol being associated with heart disease? Ooh, you mean there's conflicts of interest? Yes, there are. Hey, they haven't shut us off yet, but we did lose a viewer.
Because there's HDL and LDL. And I believe it is the LDL is bad, correct? And the HDL is good. Your HDL is higher.
And VLDL.
Then it kind of cancels out a little bit. You always want more good than bad.
You want good HDL. And so if you want a higher amount of good cholesterol, and so I'll get these patients who their doctors will show them the lab results, and it's angers me if you couldn't figure it out. It really ticks me off because they'll show the patient the lab work, and it'll just show the total triglycerides.
And that isn't the whole story.
And the total triglycerides are 320. Oh, it's way out of range, Mr. Gesundheit. You shouldn't have it that high. Okay, so what's the breakdown? What do you mean, what's the breakdown? Did he show you what it is? What's your VLDL? What's your LDL? What's your HDL? What are some of these? He didn't tell me that. We'll go back on my chart and look at it. And then you go back and you look at it, and LDL is somewhat elevated, but it's nothing to write home about. The real problem is the HDL making that overall number high. In which case, big deal. Who cares? Is
Probably eating avocado.
Is the patient obese? No. Is the patient overall pretty healthy? Pretty much. What's the overall impressions of the patient? We've lost our medical skills. What have we gone to? Just
textbook.
30 seconds in the room, you've made your textbook diagnosis, you're writing a prescription. Give me a break. One of the reasons why there's a nurse practitioner here in town, Erica Bordeaux. She works at the doctor's office on the south side of town. She went in there because they have a very good reputation of actually practicing medicine. So if you're in the Janesville, Beloit area and
I've
you're
heard good
needing a
things about
good
them.
practitioner, good Western practitioner, go see Erica Bordeaux and the folks at the doctor's office. They don't even know who I am. Well, Erica does. I've known her husband since we were in high school. Phenomenal practitioners. They actually practice medicine instead of just write prescriptions.
Because they don't take insurance, isn't it?
Right.
That's what I heard. Good things about them, though. Very good things about them.
Worth it. Worth it. So what do you guys think? I think, David, that you need to make sure you get a good breakdown on what your triglycerides are. You need someone to do an overall evaluation on your health. If you legitimately have some dampness issues, some weight issues, we need to look at bringing that inflammation down. We need to ask why, and we need to manage diet. We need to do some exercise. Probably aren't doing that right now. So these are things basic things. Again, you start basic and you work up from there.
Yeah.
Have you ever noticed that it is the folks who struggle with anxiety disorders that will feel a pain and they'll say, oh my goodness, I think I've got cancer. That's called mental illness. But isn't it interesting that that's the exact way Western medicine practices?
Yeah.
We go to the worst case scenario first. Why?
Because that makes money.
Because that makes money and because that keeps you from getting sued.
Yeah.
Oy, oy, oy. Saul, there's a reason you're under the bridge. Hey, we don't have much time. We've got to do the conundrum for this week. Are you ready for the conundrum?
Let's hear it.
Someone in Toma just called me. You know what that means? That means
We're
that
in
my
trouble.
warranty is expiring on my vehicle.
We're in trouble.
So, this week's conundrum. Do you want to read it or should I read it?
It's all you.
A patient came into Dr. Gesundheit's office complaining of right abdominal pain. What's on the right side?
What's on the right side? Let's see.
When someone comes in and they've got pain on the right side, before you get any more in depth, what does that focus you on?
If it's lower right, I'm thinking of appendix.
Uh-huh.
If it's upper right, I'm thinking gallbladder, liver.
Basic enough. We have to look for red flag signs. So when you come in with a complaint, we immediately look at red flags. We rule those out. What do I mean by red flag? A life-threatening situation. Yeah. Now, someone's going to say, oh, you just got upset because Western medicine goes there. No, Western medicine stays there. You're supposed to look for red flags, filter it out, and say, well, this isn't obviously life-threatening. Obviously, they have a labrum tear in their left shoulder. They're not dying of a heart attack. Mm-hmm. You rule that out by practicing medicine, using your skills. So, where am I? Oh, there it is. Patient came in complaining of right abdominal pain. It's right along my ribs, and it feels like I'm being stabbed. Oh, it's just brutal. Immediately, you start thinking gallbladder.
Yeah.
If the patient said it always happens right after eating, and when there was any kind of stress. Ooh, confirming. Now you got to get your hands on the patient. Now you got to palpate. Now you got to do the physical exam for cholecystitis. Dr. Gesundheit felt no abnormal swellings, but the patient did say that it was tender. Okay, this is continuing to be consistent with cholecystitis, gallstones. Yep. The patient's skin around their mouth was slightly yellow, and the patient was anxious. More consistent with cholecystitis. By the way, I've had patients that came in chronically like this, and the doctors always said, no, that's not gallstones.
Really? Those are so common. I've had issues with that already.
You've had a very storied and difficult young life, haven't you?
That one also came by no fault of my own. So
lots of fried food.
Bloody Mary with concentrated lemon. Makes it really, really purge.
That would.
Really hurt.
Take
Don't
some
recommend.
olive oil with it.
Don't recommend it.
Here's where a Chinese practitioner really comes in handy. Dr. Gesundheit took the patient's pulse and found the left sun to be deep and scraped, almost knotted, with a distinct vibration in the pulse. Question is, what was Dr. Gesundheit's diagnosis? The hint is, it may not be what you think it is.
We're not just giving it away, is what you're
We're
saying.
not giving it away. So, if you think you know the answer, write it on the underside of a cheap cajon.
Uh-huh.
One of those drum seats.
Oh,
I don't know. I think we could use some rhythm in this place.
be cool.
Write it on the underside of a cajon drum and send it to us. The conundrum, care of the Siloam Center, 839
Harding Street,
Janesville, Wisconsin.
53545.
Aha! Or call it in to Carrie at 608-314-8791 and say, yeah, I got the answer to this week's conundrum. I think it's fill in the blank. Fill in the blank. That's not an answer. Well, I thought it might be. No, Cletus. Go back to the holler. Why is he always named Cletus? Because that's what my pappy names me. Ellen in Grand Rapids. Ooh, this one's for you.
Oh.
How often should someone be getting chiropractic treatment for just generally staying healthy? I don't have any injuries or complaints. Lucky you. I just want to keep feeling good. Good for you.
That's how it should be.
Yes! I applaud thee, Ellen. Tops to you.
I say, well, let me evaluate you, see what you got going on. Sometimes people don't always think they have something going on. Sometimes they actually do. If it ends up being, you're gardening and every once in a while you get a sore lower back and you just want to maintain feeling good that you can keep going, it depends on how long you personally hold that adjustment. Some people can hold an adjustment for 6 months, 3 months, a month, 2 weeks. It really depends on the person, what you're doing, has there been damage in the past that's coming out now? Mm-hmm. It really depends. Every person is different that way.
But there's also a really interesting phenomenon. And that is, and I've heard other chiropractors mention this, and that is you may have a pattern of injury that's not yet manifesting as pain, mm-hmm. right? Mm-hmm. And so it's just kind of a slow simmer, a slow burn down there. So then the question is, how long, what is it, mm-hmm. and how long is it going to take to fix that? She doesn't know until she gets her hands on you and does an evaluation.
Talk a little bit about different things. Have you had anything in the past? Does it creep up on you on occasion or keep, repeatedly coming back? You get the same, I know, with your practice.
Yeah. In fact, I had a patient last week who came in just for wellness, going through the intake. Patient has some anxiety, some depression, high stress job, exposure to a lot of pathogens.
It breaks the body down.
I took a look at the patient. Striations on every single fingernail with some really interesting cupping on the small fingernails.
Lacking, huh?
Some flaccidity along some specific vascular bundles of the legs, which indicate deficiency. The toes, the patient tends to have more of a yang wei deficiency, which means that the patient's yin pushes out and the patient's got fatigue. She's overworked. So she says she's feeling pretty good.
Body shows otherwise.
Dig a little bit and you find out she's not feeling good. She was feeling better about a year ago when she was doing regular craniosacral and some other things. And this poor lady needs some help. Give her some treatment the first week. Try to dilate that Jue Yin vessel, that liver vascular bundle. Try to get more balance to the neurotransmitters. Work on some hormones. And this week, the pulses are a little bit different. They're a little more open. Still troubles, but they're a little more open. She's feeling better. She says, I can definitely tell a difference. Now, this is someone who came in for wellness, and you find out they're not well.
No. Or sometimes I'll be, just palpating the back and be like, I didn't realize that hurt until you pushed on it.
Yeah. So, got to get the patient into a place of stability.
Mm-hmm.
In acupuncture, once I discharge somebody from anything pressing, then it's come in once a month for maintenance.
Mm-hmm.
And sometimes those once a month patients would be a once a quarter because they're just feeling so good and they're happy.
That's good. That's what we want for everybody.
Yes. I would love to work myself out of a job.
Mm-hmm.
In fact, I can't wait for when Messiah comes back because I won't have this job.
Mm-hmm.
I can't wait. Let's do Tina.
Okay.
And we'll save Sonia, Grant, and Barry for next week.
Perfect. Tina from Santa Fe, New Mexico. How does the activator work in chiropractic? I notice sometimes my doctor uses it on my joints, and sometimes it feels like she is doing it on muscle. And it's probably both.
Chiropractic pogo stick for really short chiropractors.
So with how the activator works, you can use it over muscles because it breaks up trigger points. That's a great way to use it. I do that as well, especially in the upper traps along the paraspinals. It's just great for getting that not to let go.
I know you've used it on me, both muscularly and joint-wise.
Yep. And then for the joints, so joints really, you're not moving mountains when you're moving joints. It's tiny, tiny amounts of correction. So you're doing the impulse in it to help relieve the pressure on the nerves. Even when you're doing an adjustment by hand, it maybe feels like, wow, all these things are moving so much. It has to stay within that joint play. You're not breaking things when you hear that. You're just changing the pressure in there and you're getting the sound as a secondary. But activator works too because it's able to just tweak those joints to allow better nerve conduction. So that's the in the nutshell with activator.
Very cool.
Mm-hmm. It is cool. And I just got my new one and I love it.
I saw your new one, and that thing is like an AR-15 style activator.
When they make them black,
wow,
it means business.
It's a tactical activator.
Yes.
Does it come with black Velcro on it? Moly straps?
They don't make that one anymore.
Really?
I've been watching for that specific activator for probably 5 years.
It's beautiful.
Mm-hmm.
When my what is it, the ActiStem gun that I use for NAT, when that broke down and I had to send it back to the shop, and I was using my chiropractic activator by Peugeot. This thing, it's like a Model T of them. I was eyeing your activator thinking, wow, that looks nice. I was jealous.
I almost think it's different where it recoils than the ones they have, the newer ones.
Mm-hmm. It's lovely.
It gets it done.
It's happened again. You've wasted a perfectly good hour with us.
We appreciate it.
I appreciate it. Yeah. This is a lot of fun.
Mm-hmm.
I hope it was helpful. If you have any other questions, feel free to comment, email info@Siloam Center, call them in. If you think you can do it, call in your questions, email it in with your phone number so that we can call you back during the show next week, and that way we can ask follow-up questions.
And
if
next
needed.
week will be the last show for a little bit.
Next week will be the last show for a little bit. You're going to be gone, and then I'll be
And then
gone
you'll
the
be
first week of January.
Mhm. And this is the last show in my 20s.
Wow-wee! She's becoming a geezer. No, she's not.
Thursday.
Happy birthday to you. Happy birthday to you. Happy birthday, Dr. Noel. Happy birthday to you.
Oh, thank you, Mo.
You will be 30, which means you'll be over the hill.
Oh, that's over the hill. I thought 50 was over the hill.
Depends on who you talk to.
It's a smaller hill, I guess.
When those of us that are over the hill want to bring people and drag them along with us, we usually just
I'm
lower
looking
the
forward
bar.
to 30. I really am. I'm excited.
Well, many happy returns of the day on Thursday, and happy birthday.
Well, thank you.
Couldn't happen to a nicer person.
Oh, thank you.
Shalom and have a great week.
Bye, guys.